Temporomandibular joint. Welcome! Let's learn about the temporomandibular joint, TMJ, the key joint for jaw movement, speech, and chewing. Let's dive in. The temporomandibular joint, one on each side of the head, is a joint between temporal bone and mandible that allows the movements of the mandible for speech and mastication. The mandible is a single bone having two heads that articulate on each side with a temporal bone of the cranium. Temporomandibular joints are the bilateral components of a single craniomandibular joint. The upper articular surface, formed by articular fossa and articular eminence of the temporal bone. This surface is concavo-convex. The lower articular surface is formed by the head of the mandible. It is called as condyle. This surface is elliptical in shape. The articular surfaces are covered by fibrocartilage, so this joint is an atypical synovial joint. Joint cavity. The cavity of a temporomandibular joint is divided into upper meniscotemporal and lower meniscomandibular compartments by an intra-articular disc of fibrocartilage. The upper compartment permits gliding movements, and lower compartment permits gliding as well as rotational movements. Articular disc. The articular disc is an oval plate of fibrocartilage. Though termed fibrocartilage, it consists mainly of collagen fibers with few cartilage cells. It is congruent with both the articular surfaces. Thus, its upper surface is concavo-convex, from before backwards, and its inferior surface is concave. The concavo-convex superior surface fits against the articular eminence and the concavity of the articular fossa. The lower concave surface fits with the convex head of the mandible. The periphery of the disc is attached firmly to the fibrous capsule. The disc has a thick margin, the peripheral annulus, and a central depression on its inferior surface. In sagittal section, the disc appears to possess a thin intermediate zone and thickened anterior and posterior bands. Nerve supply, auriculotemporal nerve. Its articular twigs enter the joint from its posterior aspect. Masseteric nerve. Its articular twigs enter the joint from its anterior aspect. Blood supply, maxillary artery. Superficial temporal artery. The articular twigs of these arteries enter the posterior aspect of the capsule. Lymphatic drainage. The lymph from a temporomandibular joint is drained into superficial parotid, preauricular nodes, deep parotid nodes, upper deep cervical nodes. Movements of the mandible, depression or lowering of jaw, open mouth. The head of a mandible, along with an articular disc, glide forward in the upper meniscotemporal compartment. Elevation or close the mouth. During elevation, the movements take place in a reverse order to that of depression. First, the head of a mandible, along with an articular disc, glide backward. then head rotates backward on the lower surface of the disc. Protrusion, protraction. During this movement, mandibular teeth move forward in front of maxillary teeth. Retraction. During this movement, the head of a mandible, along with articular disc, glide backward in the upper menisco-temporal compartment. Side to side or chewing movements. In chewing movements, the head of the mandible, on one side, glides forwards along with the disc as in protraction. That was a quick look at the TMJ. Like, share, and subscribe for more simple medical videos. See you next time.